We are live.
Alright, so we have Racheli over here, and we are doing the PRP facial. Currently, I already injected one side of her face around the nasolabial fold, which is a smile line. And right now I'm working on the other side. And again, PRP is platelet-rich plasma. It's her own blood that we spin in the machine, and we concentrate the platelets. And on Racheli, I'm trying to work on an area, so everybody's customized. I look to see what area I would like to target. Usually on the first treatment, I work around the nasolabial fold. I work here to fill them up. They're going to be plump a little bit. The swelling and the redness, which is normal, usually subside within 24 hours. At the end of the treatment, I'm going to go over with microneedling with our own serum as well. And the serum, and you'll see at the end with the microneedling that her skin is a little bit more red. So that's going to take like around 24 hours to subside. Breathe in and out. It's very important to inject slowly, not for the pain.
So can you speak more to how you focus, where areas you treat, how many areas you do when you do the face, and how much PRP is utilized?
So on the first appointment, I do consultation. I go over with clients what the goal and what they want to work on, and then we kind of customize. People who are inclined to do PRP, they usually look for something more natural. I have some client who doesn't want to do fillers or Botox. This is a good approach. And I assess the face. I usually do the 3-part assessment where I look at the forehead, the mid face, and the lower face. How you doing, Racheli?
Mm-hmm.
Good?
Good.
And the PRP is excellent to work around the eyes area, which is a very delicate area. Fillers sometimes have a lot of side effects that people don't like to get fillers around there. And we can help a lot with the discoloration and some of the wrinkles. I would recommend to do around 3 treatments. So I like to do an induction treatment where we do each treatment I try to tackle a different area. So today we're going to work around the nasolabial fold, around the marionette lines. I'm going to work around the eyes. On the second treatment, I might work just on the skin where I just inject the syringes around just the skin itself to help with the texture, brightness. And then perhaps the third treatment, I'm going to work on the muscle. So we talk a lot about fillers and voluma, how it lifts everything. I can simulate that when we have some muscle around here to kind of help lift it up and promote growth on the muscle itself. And again, everybody is different. Some people do it for acne scars, so then I would work more around the scar itself to kind of promote healing. And I would recommend 3 treatments, and then I space them 8 weeks apart because I look for the healing response of the body. It takes around 8 weeks, and after that, usually it's once a year kind of maintenance. Answer all the question. Turn this way.
And how many injections do you do for Racheli?
How many points of injection or syringes? I
Both?
mean, it's right now Racheli has a really good specimen, and we got able to extract a lot of the serum. So the more hydrate you are, less fat you have in, like less cholesterol you have in the specimen, I can extract a lot of fluid. We draw 60 ml, but from out of that you get like around 10 ml.
Tell us about the different items on the tray.
So the yellow part is the serum, And I use for the microneedling aspect, and this is actually the PRP. Alright, you see, and then we load it from here to a small needle, and then I work around the areas. Or Kelly, from 0 to 10, how painful it is?
Only when you push it in that it feels a little bit, maybe 4,
Okay.
maybe 5, and then it dissipates.
Okay, perfect. So again, pain. Everybody feel pain differently.
Are you able to do something to address pain for people who might have more?
We numb the area with a prescription strength cream, but that really work on just the injection site, the numbing cream, just the puncturing of the needle. The material, because there's some red blood cells in there and they carry iron, it's a little bit acidic, so that's what actually caused the pain of the injection, and it's kind of feel like a burning sensation. You feel hot, which is normal, and that's what we wanted to see, because then we start the inflammation response basically, and that's what starts the healing response.
Can you speak to that more about the body's response, the inflammation, and what's really happening?
So basically, the analogy I take for PRP is where, like, you get a cut on your finger, you have the platelets going into the area to stop the bleeding, and then a week after you develop new skin, new layer on top of it. That's what we try to simulate with the PRP. Basically, we bring the platelets into the area. The platelets start to release chemicals like collagen, fibrinogen, and they try to create new skin, basically. And PRP, as I don't know if many of you know, it's started in surgery, where we're closing the tissue with squirt some PRP at the area, and then it started in dentistry and pain management, where people injected it to the ligaments or muscle tear to kind of create new muscle and healing. All right, so we go on the eyes.
Hi Chelsea, hi Hillary, thank you for joining.
Hi.
Michal's ready to answer any questions if anybody has.
So right now I'm trying to work around the eyes area, work more about the discoloration. Raquel doesn't have a lot of wrinkles around here, but it's more discoloration that we try to work. How you doing? Okay.
So what can we expect from a coloration?
It's actually brighten it. So we can post some pictures that we did last week, actually.
Hillary is asking, what's the downtime, if any, after?
So it can have some bruising, like any kind of injection. Otherwise, it's very simple. It's around a day, like 24 hours, you stay red, and that's more from the microneedling. There's some swelling into the area, but most of the people will not notice it.
And PRP has other applications, correct?
Correct.
Such as?
As I say, like on the muscle. So when we use people with ligament tears or muscle tear, they use it in dentistry to help healing of the gums.
Muscle tears, such as where? Like a knee or a hip?
Yeah, everywhere potentially you can do, like arms or something. It's best for partial tears, not for a full tear. Full tear is surgery, usually. We use it for hair growth too. We use it for, we offer here also the G-spot shot, which is for women. We do that to help achieve better orgasm or help with urine incontinence. Also good. I was just in a conference and they use it a lot for people with ulcers, like diabetic ulcers, and other kind of alignment on the skin. Some doctors use it after laser, kind of help the healing.
After laser treatment?
Yeah, like
Really?
a resurfacing.
Mm-hmm. With that or with the
On top of it.
microneedling?
So they do the laser and then on top of it they'll lay the PRP to help the healing.
How are you feeling, Michal?
Perfect. I thought with all these needles it would hurt more, but it doesn't.
It's because I'm gentle.
Ah.
So I have experience in pain management. I've been injecting since I was 18 at the Israeli military. I was a medic. And beside of the working in pain management, working with people with chronic pain helped me a lot to be very gentle about my needle touch. And Kelly is very good patient.
Thank you.
People they take blood thinner like aspirin daily or any other blood thinner are not a good candidate for this procedure. This is basically most of the contraindication because it affects the platelet aggregation. So it's basically very safe procedure for anybody to use.
So we have a question from Hillary. She's asking if you need a numbing agent or if it just doesn't really hurt. I know you spoke to it before, but for those people who didn't hear, maybe you can repeat.
So I put a numbing cream for 15 minutes before the procedure. And again, the numbing cream more help with the puncture of the needle. The sensation, the pain or the discomfort more coming from the material itself, not from the needle. And if you see it's kind of swollen around the eyes, that'll all come down by tomorrow.
And what kind of time frame do we expect for results?
It takes a few weeks to kick in. Initially you see improvement in some lines, fine lines, immediately, just because of the swelling and the kind of inflammation that goes, but it takes around 8 weeks to take the full effect. Now I'm gonna do around your lips. So over here, I'm gonna try to work on some of the fine lines here. Breathe. Kelly is really good because this area usually is very painful.
Yeah?
Yeah.
Not that bad.
Good.
So I think we're going to sign off and let you finish with Michal, and we'll take more videos and post them for everyone to see, as well as the preamble before they got started.
Invite them.
Yes, and come over to BeWell MedSpa. We're in Wilton, Manors, and consultations are always free. And you can come in and chat with us. Thank you. It's so nice to have you with us. Bye, Hillary. Bye, Chelsea.
Bye.